and welcome to another edition of CEO Unplugged. I'm Scary Jones from Elvis Duran and The Morning Show. We love talking to people that are in the lead with organizations. We get to know them and sit down and talk personally, one-on-one, with interesting individuals. Today, I got Dr. Matt Martinez here. He's the director of Atlantic Health System Sports Cardiology at Morristown Medical Center. You're also the league cardiologist, consultant to the National Basketball Players Association, the New York Jets, Major League Soccer, PGA, NFL, the list goes on. How's that for an introduction?
Thanks for having me. I'm excited to be here. This is great.
Wow, I just said a mouthful. Why don't you break it down real quick for everybody? Put it in layman's terms, because
Sure.
I don't know if I did it any justice.
So again, I'm excited to be here to represent Atlantic Health and Morristown Medical Center and talk to you about sports cardiology. So it is an emerging field. It's really a field that has grown quite a bit in the last decade. And it specifically is for cardiologists who have an exercise interest, handling physiology of the athlete,
Right.
and for caring for those who might be at risk for complications related to either a potential cardiovascular disease or maybe something that looks like cardiovascular disease that's just normal for that superpowered elite athlete.
So you're a sports cardiologist, right? Can you differentiate between other cardiologists? Like what is specific to a sports cardiologist?
So general cardiologists care for a variety of diseases, and they have tons of different expertise within that. So you might be a heart failure expert within general cardiology. Maybe you're somebody who focuses on valvular heart disease or the doorways that connect all the parts of the heart.
Right.
So I'm somebody who looks at the sports cardiology, the athlete specifically, and maybe they're a high school athlete, maybe they're a collegiate athlete, maybe they're a professional athlete. They have something that looks either abnormal or may be abnormal, and we help them sort out what the risk is, if any.
Right. Very interesting here. We're going to talk about this JAMA, a study that happened. And I wanted to get into that in a second. But regarding COVID and cardiology, sports cardiology, it's been a year, right, since Morristown Medical Center admitted their first COVID-19 patient.
Almost to the day, yeah.
What have you learned the most about COVID and the impact that it has on the heart in general?
So, it's been quite a year. And we have learned quite a bit. And what we've learned is that it's important to know who we're talking about, that words matter, that when you're talking about somebody who is 65, who has pre-existing cardiac conditions, and you have COVID, your risk is very different than if you're a 30-year-old who has very few risk factors, who is active and athletic. You've already set yourself up to be in a good place. So it's important to recognize who we're talking about and framing that up. So if you're an older person and you've got COVID, you're at higher risk for cardiovascular complications. If you get cardiovascular complications, the outcomes are a little worse, right? So if you're in the hospital and we find that you've got cardiac involvement, we can risk stratify you based on what we find. An abnormal blood test or an abnormal imaging study increases your risk for complications, and that helps us be a little more aggressive or a little less aggressive.
So now can we talk about the Jama Study? What exactly is it? I understand that it was a paper. The paper was published in Jama Cardiology, and it was yes. I'll let you go because I don't want to misspeak.
So when this all started, all of the leagues got together, and the CMO, our CMO is Dr. Margot Patukian, who is really a superstar in the field of sports medicine. And she and the others got together and said, how do we make sure that the athletes are safe? How can we make sure that is it safe to play? If we play, what are some recommendations we can come up with to try and make sure that we're serving the athlete? And part of that was to evaluate them using the screening protocol that we looked at in this JAMA paper. So all of the leagues collectively, almost 800 athletes from the beginning, said, we're going to evaluate you to see if you have cardiac involvement, because we know that if you have cardiac involvement in other subsets, you're at a higher risk. We want to see if our athletes are at the same risk.
Now, are these people that had COVID, or these are people who haven't gotten COVID yet, and you're just assessing that?
So you had to have COVID and you had to have documentation of COVID in some way.
So those are prerequisites.
Correct. Gotcha. In order to get in the door, this was your ticket, so to speak.
Gotcha.
You had to have an antibody positive or a PCR positive to get yourself in the door for this study.
What was your most important takeaway from the Jama study?
That the prevalence of cardiac involvement was low, about 0.5%.
Okay.
So very low.
So that's good news then.
It's very good news.
Okay.
And it helped us clarify, much like we started with, are all those who get COVID created equal? And the answer to that is no. That if you are without symptoms or mild symptoms, which we were able to define part of the study, you are at the lowest risk. And that all of the events occurred in that moderate group or higher.
Now, the study covered 800 professional athletes.
Just about 789.
Is this the biggest study to date?
In professional athletes, it is the biggest study to date. And actually in all of athletics right now, this is the largest published data looking for cardiac involvement.
What surprised you the most about these results?
I think what surprised me the most was the number, first the prevalence, right? Because early on we heard a lot of anecdotes, right? Lots of people saying, I'm going to not play, publicly coming out saying, I'm not going to play. I think that's number one. Number two, it reminded me that a good history, a good physical, that symptoms matter, that listening to the patient matters. And it reminded me how powerful that information can be. And the final piece is how there was again overlap between normal findings and abnormal findings, and sorting through those 30 to get down to the 5 that were abnormal required some expertise. And we've learned this before, right? You have to know what normal looks like before you can really define what abnormal looks like. So we learned a lot about that sort of discussion, and that pre-test probability, ordering tests for a reason, not just ordering them, is an important prerequisite.
Sure. Now, when it comes to playing sports, you have many levels of athletes. Like someone like myself who doesn't play much sports, I don't get, I don't move a whole lot. I'm not a big athletic guy, as you may have gathered by my stature. Or just by like talking to me, right? I was never into, I like to watch sports, but during this past year, whether you're an athlete or not, so a lot of us have really remained out of, right? They haven't been able to work out at gyms, right? They've maybe been doing stuff at home. They maybe not have played, full court basketball with their friends, So what are some recommendations you have, on how to get back safely to playing? Because some people are just like, is it time yet? Is it right? Some of the world is opening up now. Like, what do I do?
Yeah, it's a great question and an important one. And I think this study adds some strength to the recommendations that we made in the late fall of 2020, where we talked about that this is really an opportunity for folks to start to exercise again. That although you can't get to gyms and there were a lot of closures, there's an opportunity to maybe get outside, start to exercise, maybe use some of your own body weight, right? And exercise right in your own apartment or your own home. And in order to do that, you have to do what we recommend for years, which is, you can't win the Masters on day one, but you can sure lose it. And so you want to start slow and not go too fast, too early, and give yourself symptoms from just exercise. So that might be to develop a plan, exercise slowly over a week or two if it's been a while since you've exercised, and slowly but surely ramp yourself back up, making sure that you're not developing symptoms. Does that make sense?
Yeah, it does. Now, what about for high school and college athletes that have just been, chomping at the bit. They want to get back to playing, and then there's contact there. What's your recommendation for that?
And we've done that. So through many of the organizations we work with, we've given a specific timeline and how to do that.
Okay. So that's all been printed. It's all public knowledge, right? People could find that online.
100%. So the Pac-12 has one, the NCAA has one that we've published on their website for folks to get to. And basically it says go 50% for the first couple of days, then 70% for the couple of days.
Gotcha.
Then 80 and 90. So over about 7 to 10 days, you can get yourself back up to full blast and game ready speed.
What do you tell a nervous parent whose child is actively involved in league play?
Yeah. So as I said, I'm a parent, so I understand this anxiety. And what I tell people is that you have to watch to see how your son or daughter reacts. So they're going to be breathless, right? That's part of the deal. They're going to have sweatiness and feel like they're out of shape. That makes sense. They haven't done what they're going to be asked to do again, but it should get better over time. And that progressive improvement would be the expectation. And if you didn't have that, that would be a reason to take a pause. Number one. Number two would be that hydration and game preparation is really important, more so now maybe than ever, because the body isn't as used to it as it used to be.
Yep.
So making sure that we talk to them about sleep, about how they prepare for the game, that Doritos right before the game or between games, probably not the breakfast of champions, and that you have to prepare for that. And then the third is that there are some sinister features. So if you pass out when you're exercising, that's a real concern. If you've got progression of chest pressure, breathlessness, all of a sudden can't keep back up with all of your peers, it's reasonable to take a pause and be evaluated.
Sure. Here we are a year in, and there still isn't, a clear, we don't know everything, right? We don't know what long-term damage COVID could cause down the line. Do you fear that we're going to see an increase in cardiac issues as we learn to live with COVID in this world? Should we worry about heart damage?
It's a really important question, and one that I think, unfortunately, only time is going to sort out for us. There's no signal to suggest from prior viral illnesses and cardiac involvement that that's going to be the case. If you go back and look at other viral induced cardiac damage, they generally do really well. And that there is a subset that may be at higher risk and they develop symptoms. They may be passing out. They may have a rhythm change where their heart goes out of rhythm.
Sure.
Those are reasons that put people in a higher risk. But to your point, what we're doing for many of the leagues, certainly for Major League Soccer, is that we're asking the athletes to be evaluated again. And we're saying 3-6 months down the line, a year down the line, we're going to re-image that group and make sure that even in those that were normal, quote, up front, right, that their hearts looked okay, and those that we found things, we're going to re-evaluate them by imaging to make sure that there isn't any development over time to try and answer that question. So really important answer that needs to be clarified.
To be continued, right? The conversation will continue.
To be continued.
Yes. Now, I'm going to blow up your spot here. The cardiology program at Morristown Medical Center. I've seen the awards and recognitions. The U.S. News and World Report, most recently, Newsweek recognized Morristown as one of the best hospitals, where you ranked top in the state, number 34 in the entire country. Tell us, what's the secret sauce here? What's so special about the cardio program at Morristown Medical Center?
Yeah, so it's an amazing leadership group. Make no mistake about it. Those at the top who are making the decisions for the cardiovascular service line are making the right decisions, and they're keeping the patients in the center. They're keeping it focused on quality, not on purely volume. The volume has risen with the quality, and the secret sauce is that they are dedicated to taking care of the practitioners who take care of all those folks, and they make sure that they are delivering a high quality of care. And quite honestly, what's happened is that the volume has followed the quality. And that's what we'd hope that other centers would do. And I'm going to tell you that if you look around the country at other larger centers, other places that I was at the Mayo Clinic where I was before here, that's the model they used. So I think that the secret sauce is out, but it's hard to deliver.
What about you growing up? Did you play sports in high school or college? And what about people in your family right now? Is there anything that you could share as a dad who happens to be a renowned sports cardiologist and just, come on, now's the time to blow your own horn?
I'm not sure about the renowned part, but I love being a sports cardiologist. That's for sure. It is a passion for me. But when I'm not doing that, you will find me at a field or a court or a track somewhere watching or participating in sports. So I was an athlete in high school and in college. I played baseball in college in Ohio, and all of my children now play sports. It is the best part of my day. And I tell people my entire life happens between 5:30 and 8 during the week and on the weekends. That's when all their sports occur. Right. That's what I'm clamoring to get to some event. They are baseball players. They are soccer players. They were volleyball players. They're basketball players. And sure. All I can say is that it teaches them all of life's important lessons, how to lose, how to win, really exciting stuff.
I bet you have an incredibly challenging schedule. What do you do to keep in shape, stay focused, and how do you relax at the end of the day and unwind?
So I have a really, really phenomenal wife who takes care of most of my life when she's not working herself.
Right.
And what we do is we have two good treadmills down on the in our basement that we try and do our best to get on a regular basis. She's better at it than me. I try and put in my 30 or 40 minutes on that treadmill every single day, 5 to 6 days a week. I get on either at night and in the morning. And what I've said to myself is you got to find excuses to get on, not excuses to get off.
Oh yeah.
So that's what I've done. And then to be honest, my boys have now become slowly but surely stronger than me. So I've tried to avoid lifting with them as much as I can.
Right.
I crawl back up the stairs when I'm done exercising.
Sure. Wow.
But that's the key. It's definitely complicated. It is definitely a challenge. Some days are better than others.
Anything else you want to share with us and our audience before we wrap here?
Yeah. So keep your eyes peeled, because what you're seeing is more data now coming out that sports, especially outdoor sports, are safe. That there's been growing data that the transmission rate amongst athletes is low, that when you're on a field and what we thought initially, the bumps and the tackles and the guarding, it ends up being much, much lower transmission rate than we expected. And
this is great. I love hearing this.
Really important, wow. Right? And to respect your community guidelines, to follow public health guidelines, wear your mask, wash your hands, get your vaccine if you can do it. And really important to try and get all these kids back playing sports. It is good for the soul. It's good for their mental health. It's good for our mental health to get them out of the house.
There's a lot of hope and potential for the future. There's light at the end of the tunnel. I like this positivity.
Absolutely.
Doctor, what's the website? Where can people go? I mean, if they want to learn more about, the program, the Atlantic Health System, that whole thing, the Morristown Medical Center, information about that. Where do they go?
Great question. So atlantichealth.org is the website.
Yep.
And on there's a specific site for hypertrophic cardiomyopathy, which is a disease we take care of a lot of. It's a specific cardiac condition. You can find the Valve Center on there, the heart failure program, our imaging department, and of course, sports cardiology is on there as well as all the other services at Atlantic Health.
Fantastic. Thank you for taking some time today, Dr. Matthew Martinez. It's been a pleasure, and I've learned a lot. I'm enlightened.
Thank you for having me. Really important information you're sharing, so thanks for taking the lead.
Oh, no problem. My pleasure. And I want to thank everybody for watching another edition of CEO Unplugged. This was an important one.